In the shadowy corners of our world, a new danger lurks. It whispers promises of euphoria, a temporary escape from the mundane. But this siren song leads to a terrifying abyss. This is the dark side of flakka, a potent synthetic drug that has unleashed chaos and despair. Flakka, also known as alpha PVP, is a synthetic stimulant similar to bath salts. It is chemically related to cathinone, a substance found in the khat plant but is far more potent and dangerous. When ingested, flakka floods the brain with dopamine, leading to intense euphoria, but also severe agitation and hallucinations. Its effects on the body are swift and devastating, causing rapid heart rate, hyperthermia, and even kidney failure. It's a stark reminder of the insidious nature of addiction and the urgent need for awareness. We must shed light on this darkness, expose its dangers, and fight for those trapped in its clutches. The time to act is now, before another life is lost to the grip of this insidious drug. Flakka, a synthetic drug, is a chemical nightmare masquerading as a good time. Its scientific name, alpha-pyridinopentyophenone, alpha PVP, means little to those seduced by its street names gravel, bath salts, or zombie drug. These monikers hint at the devastating effects this dangerous substance inflicts upon its users. Manufactured cheaply, primarily in China, flakka is readily available and easily disguised. It often appears as a white or pink crystal, easily crushed into a powder. This makes it simple to conceal and even easier to add to unsuspecting victims' drinks. The drug's accessibility, combined with its low cost, has made it a popular choice for those seeking a quick and intense high. However, this fleeting euphoria comes at an unbearable price. The consequences of flakka use are severe, often irreversible, and always life-altering. Don't be fooled by its innocent appearance. Flakka is a wolf in sheep's clothing, a dangerous predator hiding in plain sight. Flakka can be ingested in various ways, including smoking, snorting, injecting, or even eating it. Users often smoke it using a glass pipe, similar to how methamphetamine is consumed. Snorting is another common method, providing a rapid and intense high. Some users inject flakka, which can lead to severe infections and other health complications. Ingesting it orally is less common but still practiced, often mixed with food or drink. Regardless of the method, the effects are swift and intense, leading to erratic behavior and severe health risks. The methods of flakka consumption are as varied as the individuals it ensnares. This synthetic stimulant, often referred to as gravel due to its crystalline appearance, can be ingested in numerous ways, each with its own set of risks and consequences. Some users are lured by the deceptive simplicity of snorting or swallowing the drug. These methods might seem less invasive, but they are no less dangerous. Snorting flakka can cause severe damage to the nasal passages and sinuses, while swallowing it can lead to unpredictable absorption rates and delayed, yet equally potent effects. Others inject it directly into their bloodstream, seeking a faster, more intense high. This method, while delivering the drug's effects almost instantaneously, carries the highest risk of overdose and infection. The act of injecting flakka can lead to collapsed veins, abscesses, and a host of other serious health complications. A chilling trend involves vaping flakka, inhaling its toxic fumes for an immediate, albeit short-lived rush. Vaping might be perceived as a cleaner method, but it exposes the lungs to harmful chemicals, leading to respiratory issues and potential long-term damage. Regardless of the method, the initial effects of flakka are swift and brutal. Users often report an intense euphoria, a sense of invincibility, and heightened alertness. However, these feelings are fleeting and quickly give way to more sinister symptoms. The drug floods the brain with dopamine and norepinephrine, neurotransmitters associated with pleasure, reward, and the body's fight-or-flight response. This chemical surge creates a powerful, albeit dangerous, sense of exhilaration. This chemical surge triggers a cascade of harrowing physical and psychological reactions. Users may experience severe headaches, muscle cramps, and intense sweating. The psychological effects can be even more alarming, with many reporting feelings of extreme paranoia, hallucinations, and a sense of impending doom. Users experience a sharp increase in heart rate and blood pressure, often accompanied by intense sweating, agitation, and paranoia. These symptoms can escalate quickly, leading to dangerous cardiovascular events such as heart attacks or strokes. The body goes into overdrive, flooded with adrenaline, as if facing an immediate life-threatening danger. This heightened state of arousal can cause users to act erratically, sometimes leading to violent outbursts or self-harm. But the threat isn't external, it's the poison coursing through their veins. the body's natural defenses are overwhelmed, unable to cope with the toxic onslaught. This initial high quickly descends into a terrifying nightmare, a cruel reminder that flocka's embrace is anything but pleasurable. Users often find themselves trapped in a cycle of fear and confusion, unable to escape the drug's relentless grip. The aftermath of consumption can be devastating, leaving individuals physically and mentally scarred. Physically, users may experience dilated pupils, uncontrollable shaking, and severe muscle spasms. These symptoms can be incredibly distressing and may require immediate medical attention. Psychologically, the effects are equally harrowing. Users often exhibit a blank stare, engage in conversations with themselves, and display erratic eye movements. These symptoms reflect the profound impact flocka has on the brain, disrupting normal cognitive functions and leading to a state of extreme disorientation. In severe cases, the immediate aftermath of flocka consumption can result in hospitalization. Medical staff must work quickly to stabilize the patient, addressing both the physical and psychological symptoms to prevent long-term damage or death. Mind under siege: flocka's psychological onslaught. While flocka wreaks havoc on the body, its most insidious effects target the human mind. The drug's impact on mental health is profound and deeply disturbing, often leaving users in a state of psychological turmoil that can be as damaging as its physical effects. The drug unleashes a torrent of psychological torment, leaving its victims vulnerable to its cruel and unpredictable whims. Users often find themselves trapped in a nightmarish reality, where their thoughts and emotions are no longer under their control. One of the most terrifying side effects of flocka is excited delirium. This condition is characterized by extreme agitation, confusion, and aggressive behavior, often requiring medical intervention to prevent harm to the user and those around them. This state of acute psychosis manifests as extreme agitation, paranoia, and hallucinations. Users may experience vivid and terrifying hallucinations, seeing and hearing things that aren't there, which can lead to dangerous and unpredictable behavior. Imagine a world where shadows dance with menacing intent, where voices whisper threats, and every stranger is a potential enemy. This is the terrifying reality for those in the throes of flocka-induced psychosis, a state where the line between reality and delusion becomes dangerously blurred. This is the terrifying reality for those in the throes of flocka-induced psychosis. The fear and paranoia can be so intense that users may become a danger to themselves and others, acting out in ways that are completely out of character. The drug also disrupts the brain's ability to regulate emotions, leading to drastic mood swings, violent outbursts, and suicidal thoughts. These emotional disturbances can be incredibly destabilizing, making it difficult for users to maintain relationships or function in daily life. Users often report feeling an overwhelming sense of dread, fear, and hopelessness, a toxic cocktail that can have devastating consequences. This emotional turmoil can lead to self-destructive behavior, including self-harm and suicide. The psychological scars left by flocka can linger long after the drug has left the body. Many users find themselves haunted by the memories of their experiences, struggling to regain a sense of normalcy. Many users struggle with long-term paranoia, anxiety, and depression, a haunting reminder of the drug's insidious grip. The road to recovery can be long and arduous, requiring professional help and a strong support system to overcome the lasting effects of flocka's psychological onslaught. Recovery from flocka's psychological effects often involves intensive therapy and support. Mental health professionals play a crucial role in helping users navigate the complex and challenging path to healing. Engaging in therapeutic activities such as art therapy, meditation, and mindfulness practices can also be beneficial in managing the lingering psychological effects of flocka. These activities help users reconnect with themselves and find peace amidst the chaos. Support from friends and family is equally important. A strong support network can provide the encouragement and understanding needed to help users stay on the path to recovery and rebuild their lives. Despite the challenges, recovery is possible. With the right support and treatment, individuals can overcome the psychological onslaught of flocka and reclaim their lives, finding hope and healing in the process. Dr. Jane Smith, a leading psychiatrist, explains, flocka's impact on the brain is profound. It disrupts neurotransmitter systems, leading to severe psychological disturbances. Long-term therapy is often required to address these issues. Take the case of John Doe, a former flocka user. John experienced severe paranoia and hallucinations which led to multiple hospitalizations. Through intensive therapy and support, he has made significant progress in his recovery. Group therapy sessions have been instrumental for many recovering users. Sharing experiences and receiving peer support can provide a sense of community and understanding, which is crucial for long-term recovery. Dr. Emily Johnson, a clinical psychologist, emphasizes, combining cognitive behavioral therapy with medication management can be highly effective in treating the psychological effects of flocka. Each patient's treatment plan must be tailored to their specific needs. Therapeutic activities such as art therapy, meditation, and mindfulness practices can also be beneficial in managing the lingering psychological effects of flocka. These activities help users reconnect with themselves and find peace amidst the chaos. Support from friends and family is equally important. A strong support network can provide the encouragement and understanding needed to help users stay on the path to recovery and rebuild their lives. Despite the challenges, recovery is possible. With the right support and treatment, individuals can overcome the psychological onslaught of flocka and reclaim their lives, finding hope and healing in the process. Body betrayed, the long-term physical effects of flocka. Beyond the immediate psychological torment, flocka inflicts long-term physical damage that can be devastating. This synthetic stimulant, often referred to as gravel due to its crystalline appearance, is notorious for its unpredictable and dangerous effects. Users often find themselves in a state of extreme agitation and paranoia, but the long-term physical consequences are equally, if not more, alarming. The drug's impact on the cardiovascular system is particularly concerning. Flocka stimulates the release of adrenaline, causing the heart to work overtime. This can lead to a rapid, irregular heartbeat known as arrhythmia, which can be fatal if not treated promptly. Long-term use increases the risk of chronic heart conditions. Flocka sends heart rates soaring to dangerous levels, increasing the risk of heart attack or stroke. The strain on the heart is immense, and for those with pre-existing heart conditions, the risk is even higher. The sudden surge in heart rate can cause the heart to fail, leading to sudden cardiac arrest. According to the American Heart Association, chronic stimulant use can lead to a 30% increase in the risk of heart disease. Blood pressure also skyrockets, putting immense strain on blood vessels and increasing the likelihood of life-threatening complications. The walls of the blood vessels can become damaged, leading to internal bleeding or the formation of blood clots, which can travel to the brain and cause a stroke. Studies have shown that long-term stimulant abuse can lead to a 40% increase in the risk of stroke. Prolonged flocka use can lead to kidney failure as the body struggles to process the drug's toxic byproducts. The kidneys, which are responsible for filtering waste from the blood, can become overwhelmed and start to shut down. This can result in a need for dialysis or even a kidney transplant. Research indicates that chronic use can reduce kidney function by up to 50%. The liver, responsible for filtering toxins from the bloodstream, is similarly overwhelmed, leading to potential liver damage or failure. The liver's ability to regenerate is compromised, and chronic use can lead to cirrhosis or liver cancer. Medical experts estimate that long-term use can increase the risk of liver disease by 25%. The drug's effects on body temperature are equally concerning. Flocka can disrupt the body's ability to regulate temperature, leading to dangerous spikes. Flocka can cause extreme hyperthermia, with body temperatures soaring to 105 degrees Fahrenheit or higher. This condition, if not treated immediately, can cause proteins in the body to denature, leading to cellular damage and organ failure. Long-term exposure to such conditions can result in chronic health issues. This extreme heat can result in permanent organ damage, seizures, and even death. The brain is particularly vulnerable to high temperatures, and prolonged hyperthermia can lead to irreversible brain damage. Neurologists warn that repeated episodes can lead to a 20% increase in the risk of neurodegenerative diseases. Flocka's assault on the body is a stark reminder of the drug's potential to inflict lasting harm. The physical scars left by the drug are a testament to its destructive power, and recovery can be a long and arduous journey. Experts emphasize the importance of early intervention and long-term rehabilitation. It is a chemical wrecking ball, leaving a trail of physical and emotional devastation in its wake. The damage extends beyond the individual, affecting families and communities, and highlighting the urgent need for awareness and intervention. Medical professionals advocate for comprehensive treatment programs to address the multifaceted impact of flocka abuse.